Hello and welcome to Designing a Certification Campaign. My name is David Woodruff. I am the editor of Critical Care Nursing, Made Incredibly Easy. I'd like to talk to you today about designing a certification campaign, why that's important, and how to go about doing it. So why should nurses become certified in the first place? That might be a question you're asking yourself right off the bat, is why should we be having a certification campaign at all? Well, there have been numerous studies over the past 10 to 15 years that have shown that certified nurses have higher job satisfaction ratings, have lower turnover, fewer errors, increased patient safety, and better patient satisfaction ratings. That's interesting. How is it that just putting a couple extra initials after your name creates all of these benefits? Well, it's not the initials and it's not the certification as such. It's what happens in order to become certified. So to become certified, nurses have to go back and they have to study. They have to look at material maybe they haven't touched since nursing school, and it renews some of their knowledge and reinforces their current knowledge and practice. Investing in a certification campaign will help you to be able to improve patient care at your institution, improve morale and retention as well. Develops an environment of professionalism among your nurses. So the international study of the certified nurse workforce found that 95% positive changes in nursing practice were related to certification, such as personal and professional growth. That was one of the highly rated ones, that nurses said that they pursued certification for their personal and professional growth. So they're interested in continuing to learn and continuing to become better nurses. Increased confidence and job satisfaction, autonomy, credibility. Well, there's a big one. And acknowledging our certified nurses on our floors helps to develop credibility among our patients. Competence, patient satisfaction, accountability. If you look at the box on the screen as well, 40% of new nurses attribute certification knowledge to a reduced incidence of failure to rescue in patients experiencing adverse effects. Interesting. So lots of positives are coming out of this whole certification process. So why don't all of our nurses become certified? Well, there's barriers to becoming certified. One is the high cost of the test. So the test is not cheap. The cost of a review course. So if somebody is going to pursue this on their own, they have to pay for the exam. They have to pay for the review that they're going to take. They have to put aside time to prepare. They have to decide what content to study. If you look at the test maps from most of these exams, in fact, some of them will even give you a study guide with particular materials to study for the exam. And if you were to just take the study guide and all the recommended reading and go through and read all that, it would be totally overwhelming. So it's very important to know what content is important to study and what content is not. There is the fear of failure. What if I do all this work and I pay all this money and I fail the exam? First of all, that is a considerable negative, but there's also that fear of failure in front of their peers. So what if they go and they take this exam and some of their peers take it and they're the only one who fails the exam? Wouldn't they feel bad? Uncertainty regarding the optimal test preparation strategies. So how do you prepare for the exam? That's another big question that many nurses have when they're looking at the possibility of certification. Lacking preparation materials, they may not know where to get them. They may not have preparation materials available to them in their units. Being unaware of the availability of specialty certification. So there are many nurses who are not even aware that there's a specialty certification. When you take a look at the standards that the public uses in order to be able to judge whether or not nurses are qualified, certification is considered to be the number one standard that the public uses when they're trying to identify quality nursing care. So how do you go about doing this? You say, okay, well, let's go ahead and let's do a certification campaign for our nurses and try and increase the number of certified nurses in the workforce. Well, first of all, we want to increase the excitement about certification. So we want to try to get them some information from the professional organizations about certification so that they can find out a little bit more about it. So it's not such an enigma that they have no idea what to do. Determine the recognition program that you will use. So it's important that we recognize nurses who are becoming certified. First of all, this gives you the opportunity to be able to recognize them in front of their peers and hopefully encouraging more nurses to become certified. At the same time, you're also giving these nurses the opportunity to be recognized by patients. So if we can put a plaque up on the unit, or if we have a bulletin board with our certified nurses, etc., that way patients can take a look and they can say, oh, wow, that's my nurse today, and she's certified. And again, from the previous work that we've looked at, that is the number one thing that the public looks at to be able to determine whether or not they're receiving quality nursing care. So how will you recognize your new certified nurses, and how will you continue to recognize certified nurses in the future? Plan your certification program, so get your review materials so that hopefully you can increase some engagement with the campaign. Pass rates increase with a live certification program. So if you're able to do a live certification program, either in-house or bring somebody in to do a live certification program, that's going to increase your pass rate. Also, live certification programs increase confidence in your nurses in passing the exam. Recognition programs that work. Okay, so we've said we need to have a recognition program. How are we going to go about doing that? Well, you can have an annual certified nurses dinner and recognition program. You can have public acknowledgement by putting it into a bulletin or something that you're sending out not only locally inside the hospital, but maybe something you send out to the community as well. Certified Nurses Recognition Day, a plaque on the unit, qualifications on a nameplate, pay differentials, announcements in the hospital newsletter, and a memo from the CNO. This was a very important component, is being recognized by the leadership at the institution that the nurses have completed this. It's a difficult process to become certified, and very few nurses actually do it. Only about 15% of the nursing workforce is certified. Provide a live certification program. Live certification programs have a positive effect on the self-confidence, the competence, the leadership, and the professional initiative of your nurses. Again, and this is coming from the American Board of Nursing Specialties, certification demonstrates clinical expertise, knowledge, and professionalism to patients, to the publics, and to nursing peers. Discuss the guarantee. Cost of the exam is the number one barrier to nurses pursuing certification. Fear of failure is a major barrier as well. These fears can be lessened with a strong guarantee, assuring passing by using proven systems, using a comprehensive assessment to be able to assure readiness prior to the nurses taking the actual exam, and individual learning plans. So look for programs that would fill some of these boxes and check some of these boxes off for you. Group discounts. This is another way to get rid of some of the fear of the exam cost and to help alleviate some of the fear of failure. You know, when nurses go into preparing to take the exam and go into taking the exam, they're part of a team. They're part of a group of people who are all doing this together. Maybe they're even forming some little study groups on the side, etc. But it helps to overcome some of these major barriers, the fear of failure and the exam cost. On some of the exams, you can save $30 and even 10% on membership by joining that professional organization. Joining the professional organization also helps your nurses to stay connected to the community of critical care nurses or whatever the specialty is. Scheduling as a group increases participation too. Focus on incentives. So focus on some incentives that you can give to your nurses that will help them to be able to perceive the value of specialty certification. For many nurses, they look at this and they say, well, this is going to cost me this much money. I'm afraid I'm going to fail. I'm afraid of how much work this is going to be. I don't know what to study. And they've got all these negatives sitting there, but they want to do it. They wouldn't even be thinking about this. They wouldn't even be looking at the negatives if they didn't want to become certified. They do want to. So when you hear people saying all those negatives about certification, those are the people who want to go out and become certified, but they're afraid of all of these pieces here, and they're afraid I'm going to spend all this money on this, and it's not even going to be worth anything. My employer's not going to care, etc. So we want to focus on these incentives. The personal accomplishment validates their knowledge. Professional credibility, not only among their peers and maybe their patients on their floor, but also in the nursing community as a whole. If for some reason they needed to relocate and find another job, they would be much more likely to be hired into that job with that certification. Personal satisfaction, professional growth and challenge, evidence of commitment to the nursing profession. Attainment of a practice standard. Confidence, accountability, competency, and autonomy. Recognition by the public. 75% of patients would choose a hospital based on the number of certified nurses they employ. Wow. So not only do we want our nurses to become certified, we want to make sure that we're letting everybody know that these nurses are certified. Plaques on your unit. This is an example of a plaque here from the American Association of Critical Care Nurses for the CCRN. And then each one of those little pieces can be engraved with the name of the nurse who has passed the exam. Another indicator that it's important, that certification is important, that you value certification, and that you want your nurses to become certified. When nurses feel prepared and competent to face critical clinical situation, work satisfaction increases and leads to potentially better retention. These are important concepts. Focus on evidence-based current concepts. Certification exams are evidence-based. That's where they get their information. How do they know what's on the exam? It's evidence-based, current. Most are refreshed every 2 years. They're broad, and so it's not just the knowledge for the nurses on that particular floor dealing with a certain type of patient. It's broad knowledge. Designed to test practice-based knowledge. Okay, so they've had a lot of time here to work on these certification exams and really get them down to the point where they're testing nurses to find out if they really know what to do at the bedside, and focuses on the most important concepts. Provide strategies for test taking and studying. And so your nurses are going to need to budget their time for studying. Using study techniques that work best, introducing strategies to decrease test anxiety, motivating, supporting new testing procedures using test-taking strategies that work best for them, and building test wiseness. These are all things that you want to include in that certification campaign so that hopefully your nurses will really be ready to go out and pass that exam. After the live event, continued study, review materials, discussion boards, support for study groups, and then a comprehensive assessment of some sort to be able to make sure that your nurses are ready. And if they don't pass the comprehensive assessment, that there's individualized follow-up to make sure that we are filling the gaps, that we're finding the gaps where that particular nurse is struggling, and that we're able to improve so that that nurse can then pass the exam. Some key points. Certification improves patient care. Big and important. Certification increases nurse confidence, collaboration, and retention. But there are barriers that exist. Typical certification review yields about 10% of new certified nurses. We would like to help you with your certification campaign. Give us a call or visit us online at thenursingprof.com. We have a proven system that can help get that number up to 97% of the certification review yielding new certified nurses. Thanks for joining me for designing a certification campaign. Again, my name is David Woodruff. Please visit us online at thenursingprof.com to learn more about how you can design a certification campaign for your nurses and get more nurses certified. Thanks again for joining me. Until next time.